The other clinical scenario we discussed yesterday is another, on the other aspect of the picture is that an old man of 55 years old presented in the outpatient department to his physician with the complaints of loss of body weight, blackening of the skin, giddiness, and loss of appetite. His investigation showed the fasting blood sugar 50 milligram per deciliter of blood, systemic arterial blood pressure showed 100 by 50 millimeter of mercury, and sitting and on standing there the blood pressure was 80 by 40 millimeter of mercury. This is the clinical scenario. Keeping in mind, you will have to answer the following questions. What is the likely diagnosis of such a case? Carrying 3 marks. And the second is, what are the other features of the disease? Carrying 4 marks. And what is the remedy of such a case? That is carrying 3 marks. In this way, we see that this is total 10 marks clinical scenario, and you may assess yourself with the background of clinical knowledge in such a case, and if you have the proper answer and clinical scenario and total functions of physiological functions of the adrenal cortex, its hyper and hyposecretion, you can very well assess this clinical scenario. And keeping in mind this clinical picture and investigation, first response shows what is the likely diagnosis. It is the Addison's disease. Addison's disease, in which there is hyposecretion and poor function of cortisol level. And this is, if you just write down the Addison's disease, you may get 3 out of 3. This is quite mathematical marks you may get. And furthermore, second part B, what are the other features of such a case? Carrying 4 marks, you will have to give that the patient complains of loss of weight, loss of appetite, and vertigo, giddiness. मरीज कहते हैं मुझे चक्कर आते हैं, जब मैं लेटे हुए उठ कर बैठता हूँ तो चक्कर आते हैं और सारी चीज़ें इर्द गिर्द की सारी चीज़ें घूमती हुई नजर आती है, ठीक है? और there may be vertigo and vomiting in such a case. And another complaint of the patient, most commonly seen, मरीज कहते हैं कि जब मैं बैठ के उठता हूँ तो मेरे आंखों के आगे अंधेरा छा जाता है, ठीक है? तो this is evident from this clinical scenario that there is postural drop. That is, on sitting, the blood pressure is 100 by 50 millimeter of mercury, and on standing there is drop of 20 millimeter of mercury systolic and 10 millimeter of mercury diastolic. And this is called postural hypotension. Due to postural drop, which is important feature of this Addison's disease, the clinician assesses only on this level. And furthermore, there is this is called postural hypotension, and furthermore there is blackening of skin, the external parts, especially the exposed parts of the body, hands and feet and face, and upper limbs, lower limbs, exposed parts. There is hyperpigmentation. Hyperpigmentation is seen, and the patient, this is more worrying situation for the patient, that especially for the ladies, they complain of that, well doctor, my skin is becoming black and black with passage of time, and I am more worried about the complexion of my skin, as the ladies are. So this is called hyperpigmentation due to increased secretion of, along with this MSH, melanocyte stimulating hormone by the anti-pituitary pars intermedia of the anti-pituitary gland, and as more pigmentation of the skin is there, and along with this we see that with these complaints of the patient described by the patient, and along with the cortisol level, we can easily diagnose Addison disease, and we can easily explain the clinical picture of hyperpigmentation, postural drop of arterial blood pressure, and low glucose level, and that explains vertigo, giddiness, vomiting, loss of appetite, and other features of the disease are well explained on this clinical scenario. As far as the cause of this entity is concerned, Addison disease, as I told you yesterday, my dear students, that it is mostly because of tuberculous destruction of the adrenal cortex. The Mycobacterium tuberculosis selectively destroys this adrenal cortex, thereby the zona fasciculata reticularis that is destroyed, and on MRI of abdomen and this ultrasound and CT scan of the abdomen shows that the adrenal cortex is shrunken and less functioning parenchyma is behind. As a result of that, we label this condition as a hypo-functioning of adrenal cortex, that is Addison's disease, and with these features in mind, and furthermore, because after confirmation and after estimation of cortisol level in the blood, which is sufficiently below the normal physiological levels, and so these patients are unable to cope up with the emergency situation, number one, and if they are exposed to infection, chest infection, pneumonia, their life is threatening the life, thereby lowering the vital signs of the body. And so these are the features of Addison's disease, and here in this clinical scenario, if the person gets infection, his level of the blood and glucose level may not be able to compete properly with that of the stress or infection, and that may end in death of the patient. As far as the level of third clinical scenario, third part is concerned, what is the remedy of such a case? Carrying 3 marks, that is total replacement therapy. Replacement therapy is the answer. As you know that the cortisol level, due to the destruction of adrenal cortex, they have been sufficiently reduced, showing these clinical signs in such a case. So in this way, we see that reduction in the cortisol level, and we give exogenous prednisolone, delta-cortrin, or dexamethasone exogenously. We give for the replacement therapy, and with passage of time, all the features, they are normalized, and that patient of Addison disease leads normal life. And it is said by the clinician that one tablet of delta cortical of 5 milligram once a day is sufficient for exogenous therapy, and in this way all the parameters and other features, they disappear with passage of time and the person leads quite normal life. If your response is according to this, you just give the name of the disease, that is, you may get 3 out of 3, and if you enumerate other features of the disease, you may get 3 out of 4. And what are the lines of therapy? That is the replacement therapy. You may get 3 out of 3. As a result of that, you may get 9 out of 10 if your response is correct and you properly know the background physiological knowledge of cortisol. Thank you very much.